Yes.
May I interject to add another question onto that, because
Sure.
it covers about 3 areas.
Sure.
There is another question in alignment with what your question is, and that is how it relates to supportive housing here in Powell River and the province, where there are no programs for those who live in addiction.
Boy, these are all nice simple questions. Look, I mean, the reality is this. We are going to need to build up capacity, and I don't think, quite frankly, government should be building all that. I actually think we need to rely on the private sector to build a bunch of that government by services. Now, we're going to need some government, we're going to need some private sector, some societies, so it's going to be government and non-government agencies that are going to be involved in terms of delivery. But we're going to have to make the commitment to buy services, which then gives people the opportunity to be able to invest in those that need to be done. So, for example, there's going to be a wide range. You know, somebody has an addiction today, and they go in and say, okay, I'm prepared to go in and to recovery, to treatment and recovery. The answer can't be, you know, I've got a space for you in 5 months. They need it today, right? When you have somebody that you need to be put into services, you need to be able to build out a space. So we don't have the capacity, we don't have the space for it, we don't have the healthcare professionals for it. We have to build that out. But the commitment is to do that, to methodically go through, build out the capacity, build out things. And I mean, everything from, I was talking with some hereditary chiefs about this, they would love to be able to host, you know, small sites, recovery, be able to use culture as part of bringing people back in, and be able to bring people from going down to the Vancouver East Side, to be able to give them treatment, to get them healthy, to be able to help rebuild their lives. Why not do something like that? It doesn't have to be all just a government-run institution. We can find solutions around how to make sure that we provide those healthy paths for people. So there's going to be a range of things that get built out in options, but it is going to take a little bit of time. There's no question. It's not just going to be on a dime that's going to happen. Oh, sorry, the part you want to ask was, oh yes, supportive housing. You know what? This is what I'm afraid of with this government. I'll give you an example of a supporting housing project in Victoria. So not only is this put in a neighborhood that has got kids and everything else going on, but this supportive housing unit in Victoria has a special room for smoking crack, a special room for smoking fentanyl, a special room for doing other drugs. And residents there go into the places to do these drugs, then they come out in the common area and they're still smoking drugs. And the staff that are working there, it's a non-profit that's running this, the staff that are working there complained to WorkSafe and said, this is an unsafe environment. And WorkSafe said, well, because it's decriminalized, I guess you'll have to wear gas masks. I mean, that's how crazy this sort of stuff is. And then there was a staff person who put a sign up on the wall, just a little notice saying, hey, you know what, if you want to go into recovery, here's some options, here's some numbers that you can call if you want to go into recovery. Ministry person came by and took the sign down and said, you're not allowed to do that because that could offend some people. Yeah. And the person who put it up was suspended for a day. So my perspective on supportive housing, or housing particularly for hard-to-house people, is if there are no services, you cannot do that within a community. You cannot put that in there because they're still going to carry on with their lifestyles, they're still going to carry on with the drugs, there's a whole bunch of things. You get dealers that come in as part of it, you get crime that ends up being part of it. This has happened in too many places. So I'm fully for building housing that needs to be done for people that need the housing, but we have to have a place where we're getting people clean, not somebody that's just at the front delivering coffee. I'll come back and talk to you afterwards. We're going to go around for other questions if I can.
There is one more question that's in the same genre. Are we mandated to take opioid addicted persons in our community from other communities?
I think the biggest thing that we have to focus on, as I was just talking about, is we need to build out services. We need to be able to build out treatment and recovery, both short-term and long-term. And so there may be cases, for example, in Powell River or in other communities where we have space for that kind of a treatment, and there's somebody that needs it, and if we can find a way to match people with the treatment, we'll do that. But I don't believe that we should be taking people and relocating the problem to another community. I don't believe that's the answer. I think the answer is we need to make sure we build out that capacity for treatment and recovery to be able to make sure we get people the best opportunities they can to be able to have a productive life.
Okay, thank you. And there's one more question. Is the Conservative government going to make hardcore drugs illegal again?
Yes. And I'm sorry. Decriminalization has to come to an end. Look, police can't do their job to have a civil society. If you got somebody that's hanging out in your doorstep smoking a crack pipe, police can't do anything about it. If you have cars coming and going from a house and it's a suspected dealer, the police can't stop the car and seize the drugs and use it as evidence to go after the dealer. I can't walk down the street drinking a beer. How come I can walk down the street smoking a crack pipe? This is nonsense. It will come to an end.
Thank you. Next question. Why are we shipping raw logs out of Canada and then paying duty to the US government for our lumber exports?
So I agree, we should make sure we cook the logs before they leave our country. Sorry. Log exports is a real challenge. When you've got the highest cost producers in the province, or in North America, when we don't have the capacity for some of the wood, you're going to be exporting. Because what ends up happening is a block gets logged, a portion of that block gets sold overseas to basically pay the freight for the logging, and then the rest of the wood is then made available in the domestic market. So we have to change that. And it can't come from just a mandate, because if we just say no more log exports, you're basically going to shut down about a third of the coastal forest industry, if not more, just because it's not economic to do. And I don't want to do that. What I want to do is I want to drive down our cost structure. What I want to do is be able to put the incentives in place to build out so we can use more of the fibers, so that we can get the higher value products, so that we get the investment that's needed in the forest sector. Because our investment in our forest sector right now is absolutely dead. Nobody wants to even look at doing anything in British Columbia. So that, to solve the log export problem, we need to bring down the cost, we make sure we're competitive, and make sure that there's the opportunity to be able to utilize that fiber locally. So that's what we're going to be focused on, because we do want as much of that fiber to be used locally. But if I just bring it to an end, the amount of jobs that we lost and the damage that we done, I think is too high. We've got to be able to create the opportunity for the investment that's needed to utilize the fiber here, as opposed to coming in with a stick.
Okay, thank you. This question is then regarding to the area on the Sunshine Coast. What do you plan to do for seniors needing to travel to Vancouver for medical appointments who do not drive, and also for residents traveling on a TAP form should have assured loading on the ferry? There is another question in this exact same genre that is asking why residents from Powell River cannot go to the island to receive medical treatment. Right now, they have to go to the mainland to receive medical treatment.
Yeah, those are very good questions, and what comes back to how we change things with healthcare as well as some things on the ferry. There's some good points about medical appointments having priority for being able to be on ferries, and so we'll need to look at things like that. But I actually look at it and I wonder, quite frankly, if the health authorities shouldn't be completely reworked. There's just too much bureaucracy going on there. And so we need to be looking at, once again, making sure that it's about putting patients first and being able to acquire those services wherever they can, wherever it's needed, but also to be able to build those services where we can. Now, we're not going to be able to have all the services everywhere in the province. I mean, that's just logical. You're not going to have that many cardiologists. You're not going to have that many pediatrics, everywhere. However, we do need to make sure that it makes sense. Like, the Powell River the people here have to go to Vancouver for services as opposed to Vancouver Island. That just doesn't make sense to me. But at the same time, Vancouver Island doesn't have the services north of the Malahat that they need. And so there's lots of services that need to be built out there as well. Because going there, and if they can't get the service, that means you've got to go down to Victoria. And that, quite frankly, is a challenging trip as opposed to going into Vancouver. So we need to make sure that services are available for when people can get out within a reasonable period of time.
Thank you.
Take a question here or not?
Yeah, on that note, healthcare, what do you plan to do about preventive medical care? Like, we have an epidemic of chronic disease, And, myself, I think it's to do with the food that we are eating and our children are eating. Do you have any plans to address that?
So first of all, like I say, doubling food production, and part of that is making sure we have local food available so that our good, healthy food that we grow is available for people that want to buy it here in British Columbia. We got to break down the cost structure to be able to make sure it's competitive in terms of making that available. So that's on the food side. Do you know, I'm going to get to the preventive medicine, but I got to take a little tangent. I apologize for this. There is a plant that is just being built back a few years ago near Ottawa that is producing, I think, somewhere around 20,000 tons of insect protein for human and animal consumption. And I asked the Minister of Agriculture last year in estimates, a year and a half ago in estimates, I said, is British Columbia going to make sure there's mandatory labeling so that you know whether there's insect protein as part of the food that we buy from our stores? They didn't even know this was happening in Canada. They didn't even know this was available in Canada. And I had, 2 months later, I had the minister, the deputy for the minister come to me and say, thank you for asking that question. We had no idea that was happening in Canada. And I'm like, if you don't know in the Ministry of Agriculture that this is happening, how is the public going to know that this could be in our food supply? So we're going to have to make sure, quite frankly, that there is definite labeling, whether it's a warning or whatever it is, so that people aren't consuming this. If they want to consume it, it's fine. Insects have been eaten for thousands upon thousands of years, probably not 100,000 years of human existence. That's fine, but I think people should know if it's in the food supply. And so, to the point though of holistic care, that is something that's going to be critical in my mind, in terms of how we build out our healthcare model, is that it has to be holistic care. Everything from preventative to treatment and various treatment options, because not everybody, and not healthcare, by going to a doctor and getting prescribed drugs is not necessarily the right answer for everybody. And there are different types of care that can be done and available, and so we want to make sure that it's supported across the spectrum for people.
One from the floor or one from here?
One from here. We'll go to the floor afterwards. Or next, is it related?
Not health related, but sales tax related, if I could. Would you consider, if you were chief government, to remove sales tax from resold vehicles less than $50,000?
Yes.
And just to give you a little of the context, I can't pay my property tax with my credit card, but I can finance my automobile sales tax right in the office. That's a double standard.
I'm sorry, I'm not a big fan of taxing people over and over and over again for the same thing. So that's just reality. So you got to find a way to be able to do that. One thing I am going to do, I'm going to get rid of that nonsense about government assessing your car and you have to pay taxes according to what the government says. That sort of nonsense will be gone. But I do want to look at used vehicles as well, because like I say, I'm not a fan of tax upon a tax upon a tax. So we're going to have to clean that stuff up if we can.
Okay, thank you. Next question. What will you do about cleaning up abandoned and polluting mine sites and LNG wells across the province?
Boy, this is a whole host of questions. I love it. So look, there was supposed to be set up years ago an abandoned well program, so that when companies come and drill out wells and take resources out of the ground, that they have to pay into a fund that is going to do rehabilitation of abandoned wells. So that's something, quite frankly, that we need to make sure is in place and enhanced if possible. And the same thing goes with mines. Every mine project in the province is supposed to have a bond that's set up for reclamation work after the mine closes. Now, of course, we have mines that have been open a long time. Maybe those bonds have to be put in place, or maybe the cost of reconciliation the cleanup work has become too much for what the bond is. So we've got to make sure we find that right balance in terms of projects. I don't want to put the responsibility on the taxpayers to be able to fund the cleanup on these projects. The mines have been open, they've been operating. We want to make sure that it is part of the agreement to get your mining permit in British Columbia to be able to do any of that kind of cleanup that needs to be done, whether that's a bond up front or however it gets structured. You do find a few cases where a company will go bankrupt, and assets will be seized and all that kind of stuff, which is why you need to be able to make sure you've got a bond in place that can't be touched, that can help with the reclamation work. There's lots of questions for it. Why don't we get through a few more and then we'll see if there's more time for more from the floor.
Okay, we're getting to the end of, there's a few more. I know that there's a few more questions over there. We've answered that one. If you want to take a question from the floor.
There's a whole other stack.
No, these, I'll just go through these ones. If you want to take another question from the floor, I'll just double check to make sure that we've covered.
All right. Sure.
Yeah, I'm just wondering, will you implement a study in how the pandemic was handled, and also how a study into what damages occurred from the vaccine and how it was mandated?
Yeah. It's an interesting question. I mean, obviously there's a 1-800 number federally for people with vaccine injuries. I've never seen any analysis or report from that. So I think we need to do a much better job as a province with our health authorities and with health in general to collect the information and make stuff available on a wide range of things. So for example, most people don't know that today almost the same number of people that are dying from the opioid crisis are dying waiting for diagnostic services and surgeries. There's, across Canada, I think it was last year or the year before, about 17,500 people in Canada died on a waiting list for diagnostic services and surgeries. So there's stats and information that we need to get out there for sure. And I don't know whether we should be going back and looking at, what I can say is this, as a conservative government, Bill 36 and those restrictions that are put in place will be gone. We'll get rid of those sort of things. We're going to make sure that Bill 36 opens the door to bring in legislation from the WHO or any of the other organizations internationally, and bring it in without any debate, without any scrutiny, without any need to take it to the legislature and just implement it in British Columbia. And so that stuff has to go in terms of, you need to make sure you have public input.
Thank you very much. I want to say that we are very grateful that you have gone quite well over the time allotted for tonight. And I do want to be respectful of your time as well as those who are gathered here.
All right. No problem. Okay. I'm going to be available, and Chris and I will be available to answer some questions and stuff afterwards. But thank you so much, everybody, for coming out. It's been a real pleasure. I look forward to the opportunity to come back probably in the near future.
Thank you.
Thank you.